I'm Jaclyn Ringstmeier, Executive Director of the Greater Medina Chamber of Commerce, and it is my honor to be the guest host for the first Coffee with the Health Commissioner podcast in celebration of National Public Health Week, which happens to be April 5th through the 11th. So thank you very much for having me today, Krista.
Thank you so much for being here, Jaclyn. I appreciate that.
Yeah, I thought we could start with a little bit about you. How long have you been with the health department, and what brought you to public health overall?
2021 marks my 29th year in public health, actually.
Wow.
In public health in Ohio. I've been a health commissioner for 16 years. This is my 9th year here in Medina County, and prior to that, I was in Morrow County.
Okay.
So smaller, rural, between Delaware and Richland County on 71 as you're going down to Columbus. You know,
Okay.
so I've been here, and what brought me into public health, it goes all the way back to undergrad. I'm actually a social worker by training. I don't know, a lot of people probably don't know that about me, but I am a social worker at heart. And early on, I saw this intersection between the quality of life that people had and their health. You could see that. I was a gerontology minor, working a lot with older adults.
Okay.
And that idea that policies and programs and access could really change someone's life and how the quality that they have in their life. That's really what got me into public health. Came to Ohio when I married my husband, and went to public health school at Ohio State University and did social work there as well. And the rest has kind of just been kind of unfolding over time, really.
Sure. I'm glad that it brought you to Medina County, the path that you took. We're grateful to have you. So tell me a little bit about what public health's role is in Medina County.
So public health, I think a lot of times, Jaclyn, people think about vaccination, even outside of COVID times.
Right.
I think people maybe think about maybe childhood vaccinations. And in a rural community, you may think septic tanks and septic systems and things like that, and maybe birth certificates. I think those are the things in people's minds that they are most familiar with, because
Sure.
those are the things that they would probably think about accessing most readily.
Sure.
And then probably beyond that, people think of some of our regulatory side, the inspection side, the things that we do, like in restaurants and things like that. But really, public health has a bigger and broader role within a community. Our job, really, and it's in the Ohio law, is really to safeguard the health of everyone who lives in our community. So for us, that means looking at issues that are affecting people's health. We look at car crashes. We look at causes of death. We look at reasons for disabilities. We look at all of the underlying factors of screenings and how frequently things happen, or how early cancer is detected. I mean, when I just think about the breadth of all that we do, I see that role is so large. It's mostly hidden to the public. I
Sure.
think that's one of the reasons why we were thinking about this podcast, as a way to introduce people to the different programs and the different professionals who are working in those programs to promote health and well-being of our citizens from the time they were born until their final days here on earth. You know, we really strive to make that high level of health be something that we can provide here in this county and really encourage.
Very interesting. So there's a lot of data that you're using to drive decision-making, planning processes, and things like that.
Yeah. You know, and the thing with Medina, we're a large county. But we're also very, you know, we have cities, we have our villages, we have townships. We have some townships that are as big as our cities. And we're that suburb community outside of two urban areas. We have
Right.
a lot of commuters, but we have a whole agricultural side, and there's so much within our county that for us to really drill down and look at what affects health or what promotes health is different in different parts of the county and in different communities, even within the county.
Sure. That's very interesting. And you touched on it a little bit. You talked about COVID-19, and obviously I think that's what on everybody's mind when it comes to health department currently. But there is a whole host of other things that you offer the community as far as services go. What are some of those that you'd like to highlight today?
S- One of the largest programs that we have our health center, but beyond our health center, for many years, we've done the Women, Infant, and Children program, the WIC program.
Okay.
And that works with families that have children under the age of 3. We also work with pregnant moms who are getting ready to have their baby to make sure that there is good nutrition and good like nutrition education and the promotion of that for healthy young families.
Mm-hmm.
And the beauty of that, which actually would probably speak to you through the chamber, is the economic development aspect of that.
Right.
Because all of those coupons that we issue and get out into the hands of our families then go to grocery stores right here in our
dollars in the
county.
community.
Yes,
Yep.
absolutely, and that's like an economic driver. So that program really has that multifold process, working with families and working with young parents and learning how to engage with your child and do developmental things. We do that in WIC, we do it in our homebound program, we do it in our children with medical handicaps program, we do it with early intervention. There's really a lot that we do with young families to get that good start. And it used to be years ago, you lived in the community where you grew up.
Right.
And we have so many families now that don't have their parents right here, that don't have that trusted person to ask that question to. And so we have dietitians and nurses and breastfeeding specialists and peer support to really help be that for families. And us, in conjunction with some great community organizations and partners, to really bring that to families. So that's one of that's a very large program for us that people may not be familiar with if they never use the program themselves. So, and then some of the other things, are kind of those really tucked in, hidden things. In the summertime, we do mosquito. We don't do mosquito spraying except on limited basis, but we have a whole system that we use computers to guide us, and we put tablets into standing water that will
Okay.
last over a period of the summer and stop with mosquito breeding.
Really?
And and we use GIS to do that, and because we know where all the basins are that hold water throughout the county.
Okay.
We have a whole system. We bring interns in who are looking at possible careers in public health, and we employ them for the summer.
Wonderful.
And we send them out to do that project. Another summertime project that I think is gaining a little bit more understanding from folks is our tick identification program.
Okay.
So if you have a tick,
There's a variety of ticks out there.
There are
Okay.
many ticks, and so you can bring your tick in here, and we have an entomologist on standby. We have a high density or a high resolution camera.
Okay.
And we can take that picture and send that to the entomologist who can identify that. So
That is-
we would know what type of illnesses you might be prone to if that tick was embedded in you.
Okay, so I have to ask, is there special bring your tick to the health department day, or can this happen any day?
It happens any day.
Okay.
We just put it in a container.
Okay, yes, that's real good advice.
Yeah,
real
yeah.
good advice. there.
So we also, we get bats in all the time. We have a
Really?
bat program.
Okay.
Yeah, if somebody had a bat that was inside their home and they weren't sure if they had been, exposed in some way to saliva, we bring it in and we actually send that to the lab and test it for rabies.
Interesting. These are the best kept secrets of the health
Those are
department.
free
I'm telling you.
They're all free programs to the public.
Anybody can access
Anybody can
those.
access any of them. Yeah.
Well, and I
Yeah.
was going to ask you too, going back to when you were talking about all the things that you do for young families, who can access those services?
Yeah. So, you can just walk in our doors and
Really?
access those services. Absolutely. The WIC program is a federal program. And the other things that we do, we just offer them to the public. You just walk in our doors.
Is the health department open now for people to come in, or are you asking them to call?
We are.
email?
We are. Yeah. During the period when the COVID numbers were very high, we did close down our lobby, and we had people coming in when we had further appointments. We had them coming in. But now we've opened up on a limited basis. Our lobby is open for our health center program, and you can now come into the lobby to get birth certificates. Before you'd have to call ahead, and we just walk them out to
Sure.
your car. Now we're starting to gradually reopen that.
That's
and
great.
Birth certificates was one of them. A lot of health departments shut down their vital statistics or really limited their hours during COVID, but we maintained that the whole time.
Good.
Because it was important. We felt for people to be able to get those official documents that they needed in a timely way.
I think they're called vital for a reason, right?
Yeah, yes,
People
yes,
need
they
them.
are.
I like it. So the health department has so many programs going on, and you're going to have several more podcasts that you can focus in on other areas. But what are some of the specific areas of focus you have for Medina County moving forward?
So before COVID, we had, and we still have, a community health improvement plan
Okay.
for the entire county, and that was developed by a large cross-section of the public, of agencies, individuals who came together under the Living Well Medina County umbrella
Gotcha.
to really look at what are the greatest health issues, what are the things that we need to address immediately, and what are some areas where if we put concerted effort from all angles at it, that we can make a difference in the health of the community. So, cardiovascular disease, very specific. We have some very specific programming around mental health, and
So
certainly,
important.
yeah. And so, those were two areas that were kind of like large umbrellas, and then within them, a lot of other initiatives. But I think looking at this past year with COVID, I know that the two things that we really need to look at very closely are mental health support across the board. That's going to be so important, and then also getting people back into primary care, because we know that people put off out of well, parts of it were closed,
Right.
some of it
The
was out of
access wasn't
fear,
there.
some of it's just now it's I really don't want to think about health. I've been thinking about COVID all year, know. So just kind of where we are with all of that, with screenings, early detection, even just as simple as going in for your blood pressure check and having
Right,
that
all the
conversation with your
routine
doctors,
stuff.
everything. So the whole thing, everything really. So I think moving forward in the next year, mental health and preventive care and kind of getting back into that are going to be the two biggest areas for us to really kind of focus efforts and to have conversations around what we're doing as a county about those things.
Sure. The community health improvement plan that you referenced, is that something the public can view?
Oh, absolutely. Yeah. So we have the community health assessment, which is all the data that was
Okay.
collected that informed the community health improvement plan. But you can find both of those on two places, the health department website. So it's medinahealth.org under the community tab under data reports. And you got to scroll
Okay.
down a little bit. Or you can go to livingwellmedinacounty.com. And that is a location where when our work groups are up and running in person, we'll have that real vibrant again. And people can follow what's happening with the data, what's happening with different programming and things like that on that special website we set aside to really be a way to engage the public and not necessarily have it feel like it's owned by the health department, because we
Right.
don't own it. We help facilitate the discussion and we're we're kind of keeping groups moving and things, but it's really an improvement plan that all of us own.
It's bigger than
It's
just
bigger
the
than
health
the health
department.
department.
Yeah.
Absolutely. Yeah.
Great. I would encourage everybody to check that out. My other question that I'd love to circle back to, unfortunately, coming out of this COVID year, you had talked about mental health was already a focus prior to COVID, and it's become even more important now, I think. So I wondered if you could touch on some of the plans that you may have in place to help educate on mental health as well.
Sure. Well, our prior to COVID, we had already, as a county, expanded the number of just providers in general. We had some new agencies coming into the community. We also expanded what had been the 24-hour helpline, and how and who gets the answers and how those are handled. That got expanded. Another big initiative really is the Suicide Coalition, the Suicide Prevention Coalition, and you're familiar, for years had been doing engaging students and the projects and things like that. They had begun doing work based on data, looking at ways to get messaging out, particularly to men, to men of of that middle age, to encourage men to not feel ashamed to say, hey, I might need some help, or how to recognize that hey, I have somebody. How do I talk to somebody about maybe you should talk to somebody, that type of thing. So that was happening. We've also have this mental health first aid, And I know in the coming year, that's going to be something we'll offer more often.
Right.
Just that way to have that conversation, to feel comfortable. I think that's part of it. You know, folks don't want to, it's still something we don't talk openly about, but I'm really hoping that after this COVID year, that people will feel like, oh man, we got to talk about my mental health because my mental
Right.
health is shot, you know?
Right. The stigma is
Yeah.
like being reduced around it.
Yeah.
'Cause I think we all experience some form
Yeah.
of mild depression, et cetera, with everything that was going on and just confusion of you know,
Yeah.
what was tomorrow going to be.
Exactly.
So-
Exactly.
Krista, if someone's listening today and they think they need help or know somebody that needs help, where can we direct them?
So in Medina County, we have a crisis line. It's 330-725-9195. Or if they feel more comfortable texting, that's a real, it's a way to reach out for help, and it
It's
feels a
an
little bit more
easier-
easier to
yeah.
kind of make that first ask. You can just text 741-741.
So important.
Response, yeah.
Thank you for sharing that.
Absolutely.
The other thing that I have on my notes that I wanted to make sure we touched on today is talking about what an FQHC is and why that's significant to Medina County. And I'm going to guess most of our listeners don't know what an FQHC is either. So if you could spoon feed that to us, we'd love it.
Yeah, it's part of that federal alphabet soup.
Yes.
You know?
Sounds important.
Yeah, yeah. Well, it is really important for Medina County. So here at the health department, we had some part-time clinics. We had some nurse practitioners a couple days a month, and we're really kind of doing some sporadic care. Then, of course, more than a decade ago, we opened up our dental clinic.
Yeah, big deal.
Yeah, and so, but what we were seeing were so many people in our dental clinic who didn't have a medical home. And there were dental issues that were actually affecting their medical health.
Sure.
And so, but we didn't have a doctor on staff. We didn't have a way to really easily connect them. So we looked at starting to change how we operated as a health department and what we could offer. So we worked with our medical community and put in an application to the federal government to change our status from a health department clinic to what's called a federally qualified health center. And for listeners, all that means is that we do all of our services on a sliding fee scale, absolutely everything. And we look we offer primary care, women's health, it folds in our dental care that we're able to provide. We really help and work with the entire person. And we do it regardless of insurance or anything else.
That's wonderful.
We offer that 5 days a week. We have evening hours, and the ability to help with transportation, Uber Health to get people here. We have a social worker on staff to kind of connect people up with other programs they might be eligible for. So it's really kind of for us that next step of being able to do everything we can to help promote health for folks.
Sure. So in Medina County, if anybody has a need, they should call the health department because there would be a way to assist them.
Absolutely. Yeah.
Love that.
Yeah.
How common is it for health departments to become the FQHC?
It's not very common.
Okay.
It's not very common. There are 5 of us in Ohio
Oh, wow.
that have made that change. Most of the health centers are freestanding, independent. There's several up in Cleveland. There's several over in Summit County.
Okay.
Richland County has one. But we had none that readily and easily serviced Medina County. And so, and what we know here is that we have many seniors who live on a very fixed income,
Sure.
which we see a lot of seniors in our dental program. But then we also know that we have individuals who maybe don't have health insurance through their provider or their employer. They have a high deductible plan, or they have there's a lot of different things now, right?
There's a lot of different barriers to healthcare.
Yeah. And for us, it's just a friendly, easy place for people to come and to get care. And certainly there's a lot of other medical care out there, but we have a lot of residents in our county.
Yes.
And so we want our location to be an option, particularly for people that are looking for that connection and assistance with other programs.
Wonderful.
Yeah.
So I have been lucky enough, like I said, I was the first host of your Coffee with a Health Commissioner podcast, and I'm looking at my notes, and I just want to make sure, is there anything that I haven't asked you today that you were hoping to cover.
Oh, gosh. No. I'll tell you, Jaclyn, you and I can sit and talk for
I know.
We can sit
Just
and
wait
talk.
till we stop recording.
I know. I was going to say, we could talk for hours on end. No. I think this is a nice introduction. You know, I can talk about public health just for hours on end. But what I'm really excited about is giving listeners the opportunity to hear from our actual staff and partners and people who work on different activities here and do work in the county. I'm looking forward to kind of giving people that behind the scenes, look at how some of that works and the opportunity to hear from not just me, but from the people who are doing the work, which are the important folks in all of this.
Absolutely. I'm excited to hand over my hosting duties. I believe you'll be taking over for the remainder of the podcast. And in the interim, I would encourage anybody listening to visit the website to find out all of the services available to the county. And I would also say that call with any questions. You guys are very accessible.
Absolutely. We are here and ready to help.
Great. Thanks, Krista.
Thanks, Jaclyn.